Hi, I'm Dr. Preston Perry, and this video is about how you test the eggs. And there are two things you really look at for the eggs. One is quantity, the other is quality. Now, quality is really hard to test. Most of that people just rely on age as a predictor, which is not perfect for things. Some people have quantity, some have quality, some have both, some have neither. Age isn't a perfect metric. However, if you are to go beyond age for predicting quality, you really often are getting into IVF or in vitro fertilization, where you're seeing how sperm and egg come together and whether the embryo grows well. And by the time you're there, you've already put $10,000, $20,000, $30,000 into figuring out that answer. That's not a frontline test. That is actually more of a treatment, even though it gives you testing information along the way. So really, most of the tests that are out there for ovarian reserve are really more related to looking at egg quantity. Now, the classic test is a FSH, follicle stimulating hormone. Some of us joke that it's fluctuating severely hormone because it is not very reliable. And remember, you can see 75% of women who are 40 to 45 with a normal FSH and 50% of women who are 45 to 50 with a normal FSH. And we know people who are 45 to 50 have a trouble with their eggs for getting pregnant. And so what you say is it's a very late marker, and it varies a lot within the same person as well as among women. And so we'd really often think of FSH as a test of the past, even though some people still rely on it. Similarly, estrogen levels and inhibin levels are also a limited or poor proxy for ovarian reserve. They don't seem to predict who will get pregnant and even entirely what their ovarian reserve is, and there's fluctuation with it. There are two really good gold standard tests for ovarian reserve: antral follicle count and AMH. Now, AMH is a blood test, anti-Müllerian hormone. You might find various tests where you can send in, and it says whether you have eggs still or not. And again, while that'll be a predictor for quantity rather than quality, AMH does have some value for that. However, there's also a lot of fertility beyond ovarian reserve, so a person shouldn't think, hey, I've got great eggs, and think they're fully fertile. If their tubes are blocked or the uterus has massive fibroids, there are all kinds of things that can be going on that are invisible that lab tests can't tell you. At the same time, if you're saying, okay, AMH will give you a number, and it's on a continuum. And if you have a low number, and for instance, I consider low below 0.5, and people even talk 0.1 as perimenopausal, I'm more worried. If I'm in the 0.5 to 1, it's suboptimal reserve, but often you can work with it. Although these people often will have lower yield with IVF because they have fewer eggs to draw upon. And people, when you're in the 1, 2, 3 range, there's often plenty of eggs there. And as you start getting above 3, and again, this is all on a continuum, but as you're above 3, there's often an overabundance of eggs, and that can relate to PCOS, where there are actually so many they get in each other's way. The alternative to AMH is antral follicle count. And antral follicle count is basically looking at the ovary. Everyone thinks they lose 1 egg per month. It's closer to 900. People will lose 30 a day, and that's a very normal thing. But the ones you see in the ovary aren't the ones that it's all you have left, but rather these are the eggs you can see before they break down, and it is a good proxy for how many people, how much people have before they sort of are running low or running out. And so if you see 25 in someone who is 30, or you see 15 in someone who's 35, you're saying these are roughly normal numbers. And if you have more or less than that, that has implications for what the reserve is. But again, this is something that's on a continuum, and also you want to know who can fool you. People who've had a lot of surgery of the ovary can be fooled. People who are on birth control pills, that can lead to an underestimate. Despite some people saying you can't, I've seen it happen many a time with birth control pills. And so you definitely want to know, can you trust the test? As well as, are there other things going on? But if you're looking for a gold standard approach to understanding your ovaries, AMH is the gold standard for egg quantity, and antral follicle count is very, very similar. There are rarely people who aren't quite as good at it, and they're less accurate in those estimates. But if you can get an OBGYN that you trust and is reliable on those things, an AMH sometimes takes 2 weeks to get back, while the antral follicle count can be an immediate result. And we all want immediate results. This is a great question. Ask more here, and please follow or subscribe and let us answer as much as we can.